Okay, hi everybody. Welcome back to the task force meeting on this Thursday, July 30th. We're moving ahead. I appreciate your time as always. So our agenda today, we're going to give you a little update on where we are in terms of enrollment. As you know, our opt-in, opt-out form was due to close yesterday. As of now, we have almost all of our families reporting. We've had to do some data cleanup. So Nate has been working on that for me today, taking out duplicate entries and things like that. So I'm going to give you a little bit of an update right now as to our percentages for opting in and opting out. I had to work for, I just switched my computer here. 1 second.
And just Lisa, form is due today. Form is due today.
Is it? No, it was due. Wasn't it due yesterday or is today? Oh, I guess it is today. It's the 30th. I don't. For some reason, I thought it was Wednesday, but you're right.
And if you need me to summarize anything, I do have it up.
Nate, do you have it up? Can you summarize it? That'd be awesome. Thank you.
Sure, happy to do it. So at this point with LBES parents, for total submissions, we have 427 currently. For LBMS total submissions, we have 231. That represents, in most cases, about 75% of our families. I don't know if you want me to do a grade level breakdown, but I'm happy to go through that too.
If you could, that would be great.
Okay, so as we look at first grade, currently we're 58% of our students have selected an in-person option. 41% of first graders, 41.8% have selected remote. That's 23 and 32 representatively. What percentage is enough? I'll just do that if that's okay.
Yes.
Okay, second grade, 58.9% have selected in-person, 41.1% remote. In third grade, we've got 61.3% in-person, 38.7% remote. In fourth grade, we've got 70.8% in-person, 29.2% remote. In fifth grade, it's 54.8% in-person and 45.2% remote. Sixth grade is 61.6% in-person and 38.4% remote. Seventh grade, 47.7% in-person and 52.3% remote. And eighth grade, 48.6% in-person and 51.4% remote at this point. For kindergarten, 69.4% in-person, 30.6% remote. Pre-K 3, that's 66.3% in-person. These are pretty small numbers. So 6 in-person and 3 remote, representing 33% for the remote and 66% for in-person. Pre-K 4, that's a small number again. 2 in-person, that's 28.6%, and 5 remote, 71.4%.
Okay, so, and as you know that today is our last day, we have a good percentage of parents reporting in. We will start calling folks on Monday just to get them to fill out the form, but I think we're gonna have a pretty small number of calls that we'll need to make. And we have had a relatively large number of families who are indicating that they would like to be in person, or also indicating that they may be interested in a hybrid model. So that would be something we would be talking through as well to continue to try to reduce our numbers. Are there any questions on that before we move on? I'm trying to see if anyone has their hands raised. Okay, I don't hear any questions. So those numbers are obviously helping our administrative team to really visualize this a little bit better, what our class sizes in person will look like versus remote. We appreciate the community getting on this and filling out the form quickly. We've been really trying hard to call and email with answers to questions so people can have as much information that they need to make the best decision for their family. So that is where we stand right now. So far, the forms are coming in at about the percentages lower than the percentages in person than we had targeted. So that's really good news for us to be able to adhere to the safety guidance pretty strictly. So with that, we are also going to, after this, have a special education update from Mrs. Tracy Rourke, our new Director of Student Services. I will talk through a little bit at the end what we'll be looking for in terms of considerations for opening, staying open or closing if we need to, the metrics that I've been talking through with other Lake County superintendents and the Lake County Health Department. We'll talk a little bit about the teacher work groups that'll be starting up next week, the role of the Board of Education in this whole process, and we'll talk a little bit about our future task force meetings. We're going to have to change our time of the day because as we move towards, getting into school, this time isn't going to work specifically for our teachers. And so we'll talk about a change in time. And then I'll just be asking our current task force members if you'd like to stick with us or not, just to email me and let me know. And we will put out the opportunity for some other folks if you feel like your time is done on our task force. So with that, Tracy.
Thank you, Lisa. Hi, everyone. Happy to be here and talk through some of our student services processes and procedures and all of the pieces that we're taking into consideration when we're planning for our return. So I wanted to start by just reviewing what was presented to the Board of Education in terms of working with our students with special learning needs. And so we want to make sure everyone knows that the district will work with students and families to ensure a free, appropriate public education for all students with IEPs and 504 plans. That's really a basic tenet of special education. We'll continue to assess learning needs and identify students who need those additional supports or require special education evaluation. I'll talk a little bit more about that in some of the next slides. Our learning behavior specialists and related service providers will work both in person and remotely to address the unique needs of all of our students. And we're really going to work to minimize that movement of students, knowing that many students receive their supports and services in small groups. That'll be something our teams will be working through. Special education staff will collaborate with general education teachers to support those high levels of learning. That's something that is regular and ongoing within our district. We will continue to abide by any state or federal special education timelines for 504 meetings, IEP meetings, and evaluations. And we'll talk about it in a later slide on how many of those timelines we have not received any relaxed guidance on that, and so those will continue to be implemented. We'll really need to focus on social emotional development of students and what the impact of the school closures have had on students when we return in the fall. All of our students who require ELL or enrichment supports will receive all of those supports, whether they attend in person or within a remote setting. We'll continue to collaborate and communicate with families, with staff, administrators, and make sure that every student's needs are met. And just a reminder that all IEP and 504 meetings will be held remotely via Zoom, unless in-person meetings are requested by families. All right. So when we think about special education and related services, we need to consider that the general education environment is what's called under the IDEA law, the least restrictive environment. And this concept is really important because when we think about a switch to a shortened day, a remote learning environment, that essentially changes what our least restrictive environment is. When we look at special education law, as a school district, we're required to provide students with disabilities their services within that least restrictive environment, and then provide all of those services, accommodations, and modifications at an individualized level for all of those students. We need to make sure that students are not removed from classrooms unless we cannot achieve that proper support. within that classroom. So if we know that a student needs that individualized reading support and it can't happen within a classroom, then we can pull students for small groups. We need to consider during this time that although our general education workday will look different, our placement decisions and our supports and services decisions are made based on what our normal general education environment looks like. So when we think about our supports and services this year, and when we're writing new plans for the coming year, we would write those as if it was a typical year. And I know that may sound strange because we're not living through a typical year right now. But as I stated as I was going through the previous slide, those federal guidelines for special education have not been relaxed. So we are still going to be implementing IEPs to the greatest extent possible within the situation that we're in right now. Now, for parents who choose a remote learning option, we would, again, as we did in the spring, create those remote learning plans, but they would look a little bit different than in the spring because our guidance has changed from what it was during the spring. And so we will definitely go through the differences between what we were doing in the spring with those remote learning plans and then what will it look like this fall. So you can go to the next one. All right, so as we've talked about before, the state guidance that we had in the spring was kind of that do no harm clause. There was limited, if any, new instruction. There was really a focus on repetition of previously learned skills. We had some guidance in terms of that recommendation of limited screen time. There was the focus on social emotional check-ins and making sure that students were feeling safe and well in their environments. We used that implementation of remote learning plans where our learning behavior specialists and other case managers were reaching out to families and collaborating on how best to implement individualized education plans in a remote setting. And that collaboration, like I said, to meet the needs of students. So in the fall, we all know we have that new guidance from the state. And so that calls for new instruction, not just the focus on previously learned skills. We'll be re-implementing all assessment and grading practices. We'll have that 2.5 hours of synchronous instruction. We'll have the use of PPE, social distancing. Now, as in terms of federal guidelines for students with IEPs or 504 plans, all of those are still in effect. There has not been changes in that. All of timelines for evaluations are in effect. Timelines for implementation and reviews of IEPs are still in effect. One of the things that we will focus on in order to meet those needs is being creative in terms of our groupings, where students receive those services, increasing PPE for staff who may need to get within and work within 6 feet of students so that they're able to implement all of the pieces of the individualized education program as necessary. We'll need to keep in mind that we need to be nimble as the guidance changes and how that impacts our supports and services for students with IEPs or 504s, whether that occurs in person or through our remote learning plans. And although guidance is not the same as laws or regulations, because the health and safety stakes are so high with COVID-19, we plan to adhere as closely as possible to that guidance while working with families to make sure we have good plans for students. So you can go to the next slide. All right, so what this means for students with IEPs and Section 504 plans. For some students, there may be very little or no change at all to their support and service plans. Like I said, we anticipate implementing those plans and giving our best faith effort to implementing those plans as written. For students who will not receive 100% of their service during the remote learning times. We will provide as much service as possible as stated in the plan, and we will collaborate with parents if we feel that some change needs to be necessary. There will be no surprises to parents and families. We will have ongoing communication to say that we need to try to meet this need in a different way. So an example that I've given to some teachers and parents when I've spoken to them is, if we know that a student gets a small group instruction in 4 different areas, we may say that's a lot of mixing of students in person, and for health and safety reasons, we may want to look at how many times a student is pulled out into a small group in a given day, and really work through that as a team to see if some of that instruction could potentially be given remotely while some of it given in person. So we will always keep careful documentation to what extent that the IEPs and 504s have been implemented. So even parents who choose in person, some students may still have some remote instruction with their case managers or learning behavior specialists. All right, so what does it look like? So for a family who chooses a remote environment for their student, case managers will reach out to parents with a schedule. So our student services teams are going to be meeting before the start of school to work through each individual schedule for students. They'll reach out to parents, talk through that schedule and what those services will look like. Case managers will communicate the plan for how the IEP will be implemented to the maximum extent possible. And if we need to implement a remote learning plan in that remote environment, that will be talked about during that conversation and come to agreements during that time. And then the services would be provided remotely. If a family chooses in-person instruction, again, we'll follow that same procedure. Case managers will reach out to parents with the schedule for their student, communicate exactly how we're going to be implementing that IEP to the greatest extent possible. We will also talk through a potential remote learning plan in the event that we do need to switch to a remote learning platform at any given time. During the spring, it was a surprise to all of us. And so developing remote learning plans was not a past practice. We know at any moment, some students or all students could be put in a remote learning environment. And so we want to make sure that we have those remote learning plans prepared in advance so that we can very quickly switch to those remote learning plans if needed. And then if a student is going to school in person, their services could be provided live and in person or remotely through their device based on the plan that is agreed to between teachers and families. All right, so we have additional learning experiences for students. These are for students who receive support for English language instruction. We will have the opportunity to provide some increased supports for students who require English language supports. We have students who will also be receiving some enrichment services, and those will be provided to the greatest extent possible. And we also have our multi-tiered systems of support, which is formally RTI, response to intervention. We are still required and providing those supports in both a remote setting and in person. We will be pulling together our MTSS core team once school begins, and we will look through how the implementation of MTSS supports can occur within both that remote setting and an in-person setting. It's good to know that many of our intervention programs have designed remote learning materials so that we are able to continue those supports no matter which setting a family chooses. So, any questions, any feedback? I would love to hear if anybody has any thoughts on that.
I'm
I
looking
have
to
a
see if
quick
there's-
question.
Go ahead. Yep.
I know that you said you're reaching out, the case manager will reach out to each family
Mhm.
associated with an IEP or a 504. Even, we will hear from them even if our review is not up for review for so long, like you will contact everybody no matter what before school starts?
Correct.
Okay.
So usually it's
Okay.
our practice that case managers reach out just with an introduction, each
Yeah.
year. So part of that introduction will be reviewing your child's schedule, if they will be pulled out of the classroom, if they're in person. We'll need to review if they need Zoom links or those types of pieces of information for you if they're remote, so that you're prepared for the start of school.
Okay, thanks.
Mm-hmm. Any other questions? I'm trying to flip through here to see if I
Yeah, please go ahead and just unmute yourself if you have any questions.
I have one attendee.
Mhm.
Do you want me to go ahead with the attendee?
Sure.
Adrian M.
Hi, can you hear me?
Yes.
Yeah.
I just wanted to ask, in your slide, you said that if people are choosing remote, then there will not be any in-person meetings with the child. And my understanding from a prior meeting was that you might be using that 8 to 10 a.m. window for some of those appointments. So is that a decision that's been changed, or maybe I misunderstood that in the beginning?
No, so we are still looking at that time. I think we're not quite ready to put that out as a definite. That would be something that we could definitely get some feedback on. But we are still planning and preparing, and we'll be hopefully making a firm decision on that soon, whether or not we'll be using that time.
Thank you.
I thought I saw Kathy. Did you have your hand raised?
I did. Thanks, Tracy.
Mhm.
I was wondering, the 504s that I am case manager,
Mhm.
most of the services that we provide for them are health related, and if they are in person. So if those families, and I've had a few contact me and say that they're choosing remote,
Sure.
would we just document then? Because why would I be following someone's blood sugar level if it's not something I would be able to help them manage during the day if they're home, for example?
Yeah, and so yes, definitely. You and Kelly have already been reaching out to families and talking through their choices for this fall, and that's exactly what we want you to be doing. And so for students who are remote, there may be parts of plans that you won't be implementing because of the choice of that remote setting. That is very likely to be. We also just need to consider, are there things either you or another staff member should be doing that would be different in a remote setting than they would have had. If there's not, and we can implement the plan as is, then great. There's no further action that needs to be taken. But for students who have some accommodations and modifications in school, we just need to determine, are there different accommodations or modifications they might need at home?
Okay, thanks.
Yep. Any others?
Tracy,
Uh-huh.
I was just thinking about Adrian's question about the morning time, and I know we talked a little bit about it, and that one of the issues was getting there and back if they are home, right? Because we're not gonna have a bus that can bring them to school and bring them home. So that was kind of one of the roadblocks, right? So
Yes. So
just
what
we
what
talked, right?
Yeah, so what we're looking at is we would have transportation if you chose busing to school. But if you didn't want to stay for the regular school day, then transportation would have to be provided from the parent back home.
Okay.
because we wouldn't provide transportation to and from just for that hour and a half, depending on how early we can make the start time. So that is correct. Anybody else? Just clicking through again.
I have another question, sorry.
Oh, go ahead. Yep.
I'm just, because I'm one of those people that are going to be doing this. Just out of curiosity, do you know when, are we going to have the schedule, because you guys, I'm sure, are still working on the, at least LBES. I know middle school has a new schedule very often, but are we going to see that at least a day or so before we come in and try and schedule things? Do you, Kelly? I don't know.
Yeah, so I don't know if we'll send it out before we meet to start scheduling and planning, but we'll have it definitely ready for when we're planning, along with class lists. And like Lisa said, we have most of our responses for who's remote and who's in person. And so the idea is to have all of those pieces available for our student services team, so that as soon as they come in to start planning, we can just hit the ground running with scheduling.
Thank you.
Anybody else?
Okay, and we can take questions at the end. So thank you, Tracy, for providing that update. A lot of the questions that we've had this week have centered around how we plan on supporting our students with different learning needs. And so Tracy's been working really hard on figuring out all the logistics of that. So I appreciate that very much. And we are going to go ahead and move to our next portion of the agenda. So it's been a very busy and interesting week in education. And I would say here as well, we've gotten a lot of feedback on our plan in the last couple of weeks and a lot of questions. And one of the big questions was around, so I'm seeing a lot of school districts go remote and make that decision. And the questions coming at our team is kind of like, how are we monitoring this? How did we determine not to go fully remote and have people back in the building? And how will we continue to monitor it and make sure that we're in the right doing the right thing and keeping everyone safe. So I thought I would go through some of this. Just for background, the Lake County superintendents have been meeting regularly with the Lake County Department of Health. He actually, a couple of members of the County Health Department have been on our meetings for the last couple of weeks. And they've really been trying to explain to us the health metrics that they are using and will be monitoring as we move through this process. So as you know, we've gone through various iterations, right? So when this all began, the governor came out with a Restore Illinois plan that had 5 different phases. And there are different guidelines for different types of gatherings and organizations in each of the phases. And as you know, we are currently in phase 4. So the kind of the top tier of monitoring is, where is Illinois at, as a state? Right now we're in phase 4. You also know probably that now the state has been broken out into regions, and that we are included in the North Suburban region, which includes only 2 counties, Lake and McHenry. It is now called McLake, Region 9. So we are Region 9. We are tied to McHenry County in terms of our metrics. So when you go to the Illinois Department of Health, you can break down the COVID statistics by region. We are Region 9. You will get a bunch of data there. Some of the data talks about positivity rates, increasing days of positivity, increasing rates and consecutive days of increasing rates, as well as some information about our hospital infrastructure and what's currently available to the general public. And those are some of the issues that you'll see there at that site. Even more granular, that hasn't been put out in public, the Lake County Department of Health is trying to get that data down to the zip code. For us, that's a relatively simple thing to monitor because we really just incorporate one zip code. For some districts, they incorporate many zip codes. And so that's a formula that's really kind of difficult to monitor. For us, it's pretty easy. We're looking at 60044. So one of the major pieces of data that we're looking at is positivity rate. Positivity rate is the number of positive test results out of the number of total tests in that zip code or in that region. And that is different from a number of positive results versus total population. That's not it. It's literally the number of tests that have been completed and the number of positive test results out of those pieces. Right now, currently, the positivity rates that are published are from March 11th all the way through the current day, or probably yesterday, because we're in, looking at the data a little bit behind. So our positivity rate in the region is around 4%. But again, that incorporates all the way from the first documented case in Lake County on March 11th, all the way to the current day. So what the Lake County Health Department is doing is trying to get us by zip code a rolling 7-day average of our positivity rate in our zip code to help us make better decisions. Right now, our positivity rate that's been reported to us from the Lake County Health Department is also that cumulative rate all the way from March until now. And again, that's sort of a misleading statistic because it's not really, it's not current. So they are working on giving us a dashboard which would help us with that data. According to the CDC, what we're looking for in order to determine staying open or closed is a sustained increase in the positivity rate per the region or the zip code, however far down we can drill. And one of the following conditions, which would be 3 consecutive days at or above 8%. We currently, with that cumulative positivity rate, are looking at about 6. But again, we're not sure that that data is totally correct because that incorporates March all the way until now. Or some of the other data, which you'll see on the Department of Health site, the sustained 7-day increase in hospital admissions for COVID-related illness, or a reduction in the hospital surge capacity, including the ICU units and beds available in an ICU. So that is all available to us through the CDC. And those are big metrics for us to take a look at and monitor. And we're monitoring those frequently. And again, looking for more specific data with regard to our zip code. And we're in a nice spot right now below that 8% rate, and also looking to get some more data just on our zip code, which will be easy for us to monitor. But there are other metrics. And so this gets to, how are we different from other districts? If other districts in Lake and McHenry County are also operating under that positivity rate, why is it that they are going remote? Well, there's other metrics that we have to look at. One is enrollment. So, we have given a choice to our community. We've encouraged them to go remote and do that at home if they can. The reason for that is because we want to adhere as strict as we can to the guidance that's been put forth to us from the CDC and the Illinois State Board of Education. We are looking to keep 6-foot distance between individuals at all times. There are some districts in Lake County and McHenry County, I'm sure, whose class sizes and classroom numbers in terms of class size, as well as facility, so the classroom actual space, would not be able to facilitate 6 feet even at half or at the percentages that we're looking to bring students back. So when you're looking at class sizes over 30, even if you had 40% opt out in a small classroom, you cannot maintain 6 feet distance. And so that is a metric that is very limiting for some school districts. For us right now, based on our numbers, we should be able to keep 6 feet distance between individuals at all time, given the numbers as they're coming in now. The other piece is our ability to provide personal protective equipment, supplies, and ensure that the safety measures are implemented with fidelity and integrity. And that's where we're working on our procedures, and we'll get to in a second how we're going to be asking for teacher support on some of these procedures and the best way for us to keep monitoring those safety guidelines. Another piece is our substitute pool. So our pool of people who would be available to us should anyone get sick and not be able to come to school. And we need to maintain that at a nice, healthy number. And then the other piece is quite frankly, perception data. So, as we move through this process, whether or not people feel safe, given the safety precautions that we're putting in place, makes a big difference into, whether or not this is going to be a successful model. I'm sure that many of you have heard that some of the districts that are going fully remote, nobody in the building, are now looking at ways to provide safe spaces for learning in the schools for the families who cannot do the learning at home. Very similar to our plan, because as we talked about, we are going to be using that remote learning or that online or e-learning platform as the foundation for instruction, both in person and at home. So kind of similar to our plan. And the idea is we want to have as many people feel safe in the spot that they are, and also feel like they are getting a guaranteed viable, experience in education, given the fact that they've, whatever choice that they've made. So I know that, for me, when I look at the feedback that I've been getting from parents and community, that a lot of very positive feedback. The negative feedback that I have received from community and parents is more on the end of, why can't we have all kids in? I don't understand. We should be able to have everybody back. We should be able to kind of get back to normal and not be doing remote learning in school or have that online blended piece happening in school, kind of a perception around that. And so I've been talking through with a lot of parents how, the goal for us is consistency. We know at some point these metrics are going to be heading in different directions. The positivity rate, the hospital beds, wherever Illinois goes in terms of their guidance, and we're going to have to follow that. But essentially, we're looking for consistency. Now, I also know that we have all their stakeholder groups. And I've heard recently, from some parents that have talked to me, but also from some others, that our teachers may not be feeling as safe or comfortable with the measures that we have in place. So as a task force, I'm hopeful that we can kind of have a little bit of a discussion here. We have a little bit of time left today to have a little bit of an open discussion about how people are feeling about the plan right now, really, and what else could we do to make people feel more comfortable. Obviously, aside from the safety, I know that we have folks who work in Lake Bluff whose children are in districts that have gone remote. So from our end as an administrative team, and I'm in that boat, I have a 5th and 3rd grader that I need to figure out in terms of remote learning. We have been working closely with the Park District to find a way to have a place for our employees' children to come and be supervised during their remote learning experience to facilitate the ability for our teachers to come in and work and be in school with our kids. So aside from that piece, which we're still working out, I do want to kind of open it up for anyone to express, where are the parts of the plan that we could do better? What else do we need to do in terms of giving information or even adjusting to make sure that people are feeling comfortable, because we cannot run a school without our staff. We want to make sure everyone feels safe and is safe. So again, I just want to kind of open it up to give the opportunity for the task force to bring the feedback. This is the purpose of the group. We want you to be taking the plan out, talking to people, bringing those thoughts back. So with that, I'm going to be quiet and kind of let folks talk if you have anything to share.
I'll jump in. As a teacher, I will be totally transparent. I have concerns about the safety of our students and of myself. I'm curious to know a little bit more. We talk a lot about PPE supplies and safety measures in a lot of general terms, and I'd like to know a little bit more about what exactly that includes and entails.
Thanks, Jackie. So hear you, and let's talk through PPE a little bit. So top of mind is 6 feet. And since March, we've been hearing such interesting information about the 6 feet issue. So CDC has come out and said 3 to 6 feet. The American Academy of Pediatrics has gone back and forth. ISB has offered some guidance. We are sticking to 6 feet. So I'm going to put that out there and say, we are going to be working with teachers and kind of working together to set up classrooms in a way where everybody feels comfortable. Individuals are 6 feet apart. We know that makes a big difference. Masks are required. I mean, that is, something that is, thank goodness, off the table now. Everybody knows that we'll be wearing masks all the time. We are providing 2 cloth masks for every staff member and student. We're asking, though, too, for you to bring the mask that feels most comfortable to you if that cloth mask isn't the one. And certainly working with families in terms of if a student is having trouble with that, providing some support for how we can get them to do that appropriately. For some of our kiddos, or maybe some of our staff members too, the mask might not be medically the right thing for them. So we are working individually with those families to determine if the mask isn't right, then what personal protective equipment can we have them engage with? That might be a face shield, or it might be nothing. And if it is nothing, then in-person instruction is not the right place. So we'll be working for them to go remote at that point, because we really feel strongly everyone needs to be wearing that mask. We have purchased, and they should be arriving soon, trifold plexiglass shields that will be around every student at their table or desk, and around teachers. So those look like the big trifolds that you would use for like a science fair. But again, they're clear and they're washable, and those will be between as protective barriers between teachers and students all the time.
Can I just ask how those are secured to a desk or a table, or how we're envisioning them kind of staying put?
That's a good, we're going to have to look at that when they come in, and that's a great question. So that's something we'll be taking a look at. They do fold up, so we'll have to make sure they are secured. So I appreciate that. In addition to that, we have worked with certainly student services teachers. Tracy's been communicating a lot with like therapists who deliver closer instruction with kids. What do they need in order to feel comfortable? Sometimes it's not only a mask, but also a face shield on top of that. Sometimes that's gowns, sometimes it's gloves. Certainly gloves and gowns for folks who might be supervising lunch. That's not everyone, but those folks who will be doing that. And then writing up procedures to help us with monitoring and managing kind of that lunchroom time. I know that's a little bit nervous for people and creating some anxiety. Jay, are you on the call? I think you are.
Yes.
Jay, what else am I missing in terms of sanitation or other equipment that we've ordered?
We have, let me look at the list. We have lots of hand sanitizers, so there should be no lack of hand sanitizer. You mentioned gloves and gowns and masks. We have thermometers and pulse oximeters for the nurses, and several others in case we need to take temperatures. We have also ordered, currently our air filtration system at the elementary schools already uses MERV, what they call MERV 13 filters, which is the highest filtering you can have. At the middle school, because it's an older system, I think it currently uses, I think, number like 8 or 10, and we're bumping those up to 11 and trying to get 13s, which you can only do temporarily because the system wasn't designed for it, but we have them ordered and they should be in a couple months. We're going to go up to 11 and then 13 when those come in. We have electrostatic sprayers for disinfecting, which gives much better coverage. It's a way to apply a minimum amount of product, but get greater surface coverage to increase our sanitation. I also have nanoseptic door handle covers. So all the high touch surfaces will have a film on it that resists, uses light, and it creates kind of an antibacterial, antiviral surface. So that those surfaces will be sanitary. And I think I can't think of anything else off the top of my head for things that we've ordered, but just as you said, precautions. And I'm currently working on signage and stickers and things for hallway flow and where kids stand when they are in line to enforce social distancing practices.
The other piece that I want to mention cautiously is that I've been talking to some area superintendents about how we can partner together to perhaps offer some actual COVID testing on site for our staff. We are looking into possibly utilizing the ID Now test, which is the rapid 15-minute test. This would not be a test that would be offered in lieu of, an actual going to the hospital and having the swab done with a 4 to 7 day result. Because if there was a close contact that we would identify, that is the test that we would use for that. But just for peace of mind, we imagine that there would be some folks who might come on campus, come in contact with a student who may be exhibiting symptoms for a few minutes before we identify it. And that some of our staff might feel better if they had the opportunity to have a rapid test. So we are working on that. Finance and funding on that is a little bit of an issue. They're $50 a test. So we've been meeting with some folks to help us fundraise and provide some funding for this so that we can, again, provide peace of mind for our staff and kind of be able to give some more real-time information about, how they're, if they're feeling bad or anything like that. I mean, the other piece is just very realistically, if anyone is exhibiting any symptom on that COVID-related illness list, they will be asked to go home. They will be asked to go home, get medical consultation, and only return with a doctor's note. That's for students or staff. And that is a long, exhaustive list of symptoms. So anyone exhibiting those symptoms will not be allowed to be in the building. So just that is sort of something for everyone to keep in mind. That's an ISB guidance that's been clarified along with that 6 feet. And we will be strictly adhering to that. So as people on the call who can, are watching this or seeing this, there's quite a lot of logistical planning that we're trying to do in order to bring students back. We know that it's best for students, especially our little ones, to be with our teachers. A majority of the concerns that I've heard from parents in terms of kindergarten, first, second grade is like, how do we do this? How do we teach a child to read? How do we monitor fine motor skills? How are we doing all that in a remote environment? And so again, we are doing our absolute best to keep this option for the community. But on the other hand, we want to make sure that everybody has what they need to stay safe. And we'll encourage everyone to adhere to those practices, not only with us in school, but as a community of teachers, parents, students, that out in the community and when we are not in school, that we're also adhering to those safety protocols, because we don't exist in a bubble. So we can do all these things in school to keep everyone safe. But as we know, if we leave the building and we engage in another activity where we're not wearing masks or we're not practicing physical distancing, engaging in, some kind of social events or something, we might be bringing something back to that environment that we can't control. So again, there's the mitigation strategies that we have in place at school, but we really are making a plea in order for this plan to work. We all need to be in this together and really watch what we're doing all the time so that we're being as safe as we possibly can moving in and out of the building.
Can I add on to some of that? The first thing I think, to kind of go off what you were just saying, Dr. Leali, I think a little bit of a plea to the community, and just as a teacher who's going to be potentially in this room with however many children, to practice mask wearing as much as possible, whether it's at home, just sitting inside your house, like watching TV, just getting used to that process. I know even for me as an adult, it's hard to keep a mask on for like a long period of time, or at least be used to it. So as we know with everything, practice really helps. And especially with younger kids, instead of them just suddenly having to do something like that, having some practice will be really important. I'm not saying to mask your kids all the time, but just having some experiences so that it's not a shock to their system. And I think one other thing about Jackie's concerns with some of the safety measures, there's been a lot of talk amongst teachers about lunch and the fact that lunch will be eaten in the classroom where these students are sitting with masks on and with 6 foot distance, which I'm really happy to hear that we're adhering to that strict 6 feet, because that's, the science is really important. But once masks are removed, obviously that 6 feet becomes a little more dicey as far as droplets are concerned. And they have, done some studies where these droplets can remain in the air. And what are we doing about some of that? Because I think that's some of the thing that's, I think people feel good about masks. And as we've seen, like mask wearing has really become the top of the list for safety. But I think when these masks are removed to eat, they have to be, what is that gonna look like as far as distance goes? Will it still be 6 feet, or how are we?
Yeah. That's, students will have to sit 6 feet apart at their own individual desk behind their shield. And as we're talking about the procedures for that, we've talked through, if I'm the lunch facilitator, everyone keeps their masks on. We know what the lunchroom is like, right? People need help opening their milk. People need help with their oranges. People need help, whatever. We would literally keep all of our equipment on until everyone's food is ready to go. And the facilitator would be your teacher, whoever's supervising that period, would have gloves on, kind of go around, support the kids, make sure they have everything they need. And then at that point, the teacher sits back behind their own shield. Everyone takes their masks off. They have a certain amount of time to eat. We put the masks back on before we clean up, so that we can be as safe as we are in our own space, 6 feet apart. Yeah, there are some of the districts that are deciding to do a hybrid option are, avoiding that lunch situation entirely. Unfortunately for us, because of our transportation issue, we need the delayed start. And so they are with us during lunchtime. And it would be difficult, I think, for our kids to manage that long without eating anything. And so we aren't able to avoid that, but we do think with the procedures in place that we can get kids into a good, safe routine. And then obviously after that, washing hands, making sure everything's put away and all those pieces. So it's a great question. And Amanda, I 100% agree with you. The practice makes a big difference. And my own kids, I've seen them as we go out to stores now, we're in a habit. Like everybody brings the mask when we get in the car, they know what to do, they know how to do it, but it has taken some work to get us to that point.
Mm-hmm.
Other thoughts?
I have a thought, or more of a question about the recess, how we talked before, if that's still in place and where masks are going to go when you're giving kids a mask break. And also if we could make sure that, because I've seen even in public, people improperly wearing their mask, holding it down under their chin to talk. Well, all of this is exposed to droplets, and then you're putting it there and you're putting it back on your face. So I think that's a pretty important piece to discuss with parents and students and even staff about the proper way to wear the mask, and just trying to figure out where, when these kids have mask breaks, where are these masks going? Because they on the outside have, potential to have the droplets or, anything on it. So I think that's
Sure.
one thing I had.
Yeah, and I think when we get into our teacher work groups, that's one of the work groups that we're going to be working with to kind of develop some of those procedures. Teachers know our buildings and our outside spaces intimately, right? And where we can have a space to put a mask, or what we can do to maybe bring something outside that you can put your mask into while you're outside. But we have to really be realistic at the fact that even outside, we need to maintain a 6-foot distance. There's no contact outside. There's not going to be tag. There's not going to be shared equipment. This is really a break to just take it off, get outside, move around a little bit. When I take my mask off, I hold it. I'm still holding it because I'm going to put it on pretty soon after that anyway. So some of that we'll talk through, and some of it will probably be age dependent, and what the student can handle at that age. And that's why we really need to get the teachers involved at this point, because there's some of these details that teachers would be way better equipped to help us with. But it's a great question, Kelly. And to your point of proper mask wearing, proper taking it off, there are some great videos that are out there that we'll be asking parents to take a look at. If there isn't something that we want to say that's out there already, we'll make it. We've talked with our principals about kind of a video, like a flipped coming back to school, where there's a video of when you get here, this is what you're going to see on the floor. This is how far you need to stand apart. This is what you're going to see on a water fountain. It's not going to be the same. This is what your desk will look like with the shield. So just trying to give kids and parents an opportunity to see it ahead of time, what it's actually going to look like and what all of that means.
Okay, thank you.
Thanks, Kelly.
I have a question about lunch again. We talked about lunch being a 25-minute block, but thinking about the hand washing and then grabbing the lunch and just also maintaining that 6 feet apart. Will teachers have time to kind of plan for that and how that's going to look like, and also kind of get the kids into that routine? Because 25 minutes just in our regular lunch period is really hard, especially for the younger ones. And then ensuring that they're staying safe and healthy. I don't know if we can carve out more space for that, or kind of implement a routine.
That's a great point, Sarah. Sarah, you're a younger elementary teacher, so those first few weeks, it's you need to plan double the amount of time to do everything that you want to do in terms of routines. And for the parents that are watching, we use a term sometimes, go slow to go fast. It takes a lot of time to build these routines. These are new situations for kids, new situations for teachers. Those first few weeks, it will take a lot longer to walk students through this. That being said, Jay's been working with our food service to have that prepackaged, easily available to the classrooms. I can't tell you exactly how that's going to be, but it'll be as efficient as we can make it. So we will work with you on that. And certainly, even this morning, the admin team was talking about, some of these breaks that we're incorporating in the schedule, they'll be longer at the beginning, until we get out into that routine and kids are feeling what that feels like and what they need to do. It's always longer at the beginning for sure, Sarah, but thank you for bringing that up.
Thanks.
So with that, we only have 5 minutes left. I want to be careful is there one other person? Go ahead.
Sorry, it's Carrie. I had a couple questions from parents over the last couple weeks, and of how like the day would, because some people wanted to get pods going or like small groups at their own homes doing maybe like 4th grade work, 3rd grade work, etc. But would the entire 4th grade team be on the same schedule at the same time? Like math would be at 10:15 and then they would break out into small groups. Because if that is the case, how can we would the Zoom look like 50 people or the entire grade on at the same time? Or would it be broken out into their small groups?
So I can let Kelly talk this because Kelly and Audrey are doing a lot of the specific planning for this, but I'm going to tell you, I think there will be probably a time for both potentially, the time when a bigger group is on and then the time for breakout. But Kelly, do you want to talk a little bit about that?
Yeah, absolutely. Carrie, great question. Right now, the vision would be, you mentioned 4th grade as an example. So as we construct that 4th grade schedule, all 4th grade classes would be following the same schedule. And I'm looking to even line that up with the same specials so that everything is very universal and very consistent. And as far as sort of the Zoom and the class meeting concept, still trying to center it around the classroom teacher hosting that. There's been a lot of comment and teachers and parents expressing the need for the classroom teacher and having that connection in place. At this time, there hasn't been a whole lot of, as we illustrate this, we're not thinking really that all 4th graders would be on at the same time. Well, they'd all be on, but the Zooms would be separate by class. So the remote students are on the same Zoom link with their teacher, and there will be scenarios in which it's the whole remote class. There are other instances where it will be sort of breakouts into small groups. So they would be separate. Right now, it would be separate Zoom links for each class. They might all watch the same video that might be pre-recorded, but we're not seeing that there's whole grade levels on at the same time for instruction, if that makes sense.
Yeah.
I may only add, just in case people are thinking about that same thing for middle school, that we would be much the same in terms of elementary. Just not all classes are able to be streamed to the entire grade level. We have kids in different languages and different math classes, and so those will be done on a smaller kind of group basis. Only other thing that I wanted to add, just because I know we've had some confusion even internally about this, right down to the language we're using. Just a reminder that remote learning is occurring regardless of whether you're in the building or out. I know Dr. Leali had already kind of shared that, but when we use the term in person, what we're meaning there is remote learning here in the building versus remote learning at home. And really whether the student is accessing the remote learning from the building or from home, it's going to be much the same. So I just felt like I needed to put that out there. I'm personally trying to remember to use the language that way as I talk about it with the staff. So figured this was a good place to acknowledge my own attempts to be consistent.
Yeah. And I appreciate that, both of you weighing in. And, we've had a lot of questions about, is it going to be, in school, my student on a laptop or on an iPad all day long for 5 hours? That's not the intent, whether you're home or at school. We will be, though, working off of that same platform and trying to get more authentic things that kids can be doing on their own or pencil, paper, and those kinds of pieces too. So we're looking logistically at how we can make this more authentic for both groups, in a situation that's really as engaging as possible. And I know our teachers will be all over it and they'll make it an amazing experience for our kids. I do want to acknowledge just really again that, this is a really difficult situation for parents. It's also a very scary situation for teachers and educators as we are turning into the essential workforce that people are depending on right now. And I want to highlight that and acknowledge that this is a really difficult time to be an educator. And we really need the community to kind of rally around and support us with keeping everyone safe. And that is what is going to make the difference between us being able to continue to offer this program and us being in a situation where we need to all move remotely. That being said, we are going to move into really quickly. I'm at my time, but we will be having teacher work groups start next week to figure out some of the logistics and the details now that our enrollment is in. We'll start be calling families. So if you know of any families who haven't turned in their form yet, please tell them we need you to turn in that form so that we can start really getting into class lists and schedules and telling teachers who they're going to be working with. Another quick question we've had is, what is the role of the Board of Education? You know, some districts have been voting on the plan, some boards have not been voting on it. The ISB guidance on the blended learning situation is very, very clear that this is a superintendent and administrative plan. And we are to be in consultation with our board, but that we need to be able to pivot quickly many times throughout this situation, given changing guidance and watching all of the metrics that I just talked about. And so we brought our plan to our board. They have approved it. We will continue to keep the board informed. There was no official vote because we want to maintain that flexibility as an administrative team to do what we need to do to amend the plan based on what's happening. And then finally, future task force meetings. We're looking at keeping them on Thursdays. We'll try for a morning time. When we get into school, it would be during that maybe 2 hours that would be in the morning before school for an hour, or maybe even break it down to 45 minutes as we're just monitoring then at that point. If you're still interested or if you're not interested, so I guess I'm asking you to email me either way, email me about your interest regarding staying on the task force, or if you're done and feel like you'd like somebody else to have the opportunity. The goal is to keep this going. We need you as a feedback group. We appreciate you. Appreciate your time, appreciate how you've gone out to your constituent groups and gotten feedback. If there's something you wanted to say today that we didn't have time for, please email me, building administrators, any of our administrators. We're watching and we need your feedback and support. So with that, I appreciate you coming today. I kept you over 2 minutes. Appreciate your time, and be in touch if you need anything else or have any other questions or concerns. Thanks, everyone.